obulamu buno bufaanana ng'eccupa eya dripu ku mulwadde etonnya ettondo limulimu bw'olaba erwawo kuba etonnya ttondo limulimu naye buli eritonnya teriddayo bw'ekyonebwamu ekyo tukigeraageranye ku bulamu buno tulabe nga n'owaakeesa olunaku lumulumu nga lukyanga zikuweddeko ennaku zo tukeesa lumulumu terudda omuwendo gw'ebiseera bwe gutyo ozannyira mu budde bw'ofunye kiba kitalo nnyo ekyo tukigeraageranye ku bulamu buno tulabe nga n'owaakeesa olunaku lumulumu nga lukyanga zikuweddeko ennaku zo tukeesa lumulumu terudda omuwendo gw'ebiseera bwe gutyo ozannyira mu budde bw'ofunye kiba kitalo nnyo obulamu buno buwenyuka ng'essasi olw'obutamanya ne tusooba ne tufa nga bingi tetubikoze kityo yagenda essira kumwa yafa apangisa iri ntinda abantu be yabaleka mu kazigo nga buli mwaka ajuliza buddako ekyo tukigeraageranye ku bulamu buno tulabe nga n'owaakeesa olunaku lumulumu nga lukya.
Severe mental illness, some people call it serious mental illness, are those major mental illnesses which disturb one in such a way that they are not in contact with reality anymore. They can't tell right from wrong. They keep hearing things that are not there, or seeing things that are not there, or believing things that are not there. In our ways, in our medical terms, we say there's psychosis or psychosis. And that is usually what people mistake to be mental illness. That's what mental illness is all about. Actually, they don't make the majority of the mental illnesses. Many of the mental illnesses are what you might call, I don't want to use the word minor or neurotic, but there are things like anxiety, depression, obsessions, stresses of everyday life, eating problems, relationship problems, these things that make your life uncomfortable and unenjoyable in your everyday. There are also other illnesses which involve memory, for example, not being able to remember things, like dementia, or being totally confused, like in delirium. Still, all of those are mental illnesses. Epileptic fits, things like that. So, there are many various types. But severe mental illness relates to those illnesses which we call psychosis, like schizophrenia, like bipolar disorder, like the other psychosis that disturb an individual and don't allow him to relate to reality meaningfully. For a long time, we didn't know the cause of severe mental illness, and we used to say they were functional psychosis or certain functional illnesses. But through more research, we have found that many of these are related to chemical imbalances in the brain, which imbalances can be caused from inborn causes or inborn errors, maybe genetic, or even chemicals that we take to disturb the chemical balance of the brain. For example, people who are addicted to drugs or alcohol will have psychotic illnesses, and they can be quite problematic. Or you can have direct injuries to the brain, physical injuries like trauma or accidents, or infections which go to the brain and affect them. Even sometimes cancers, things like that. But in most cases, they really come from out of the blue, from a chemical imbalance, And there are many chemical imbalances in the body, not just the brain. For example, chemical imbalance in the pancreas will give you diabetes. In the kidney, it may give you high blood pressure. In the thyroid, it may give you thyroid disease. So there are many chemical imbalances. But those in the brain will cause these major illnesses, depressions, major depressions, schizophrenia, bipolar disorder, and many others, which we don't want to use too many names, but which doctors know. And all our local languages have these names. Some of them used negatively, and I prefer not to use those names. The severe mental illnesses change one's personality totally. Many lay people, or many people attribute them to supernatural causes, spirits, witchcraft, demons, magini, things like that. And they feel that they cannot be handled easily. But we have medications these days to deal with them. But also the other treatment of mental illness is psychotherapy or counseling, whereby you support individuals as they go through these turmoils. And also sometimes environmental changes to give more confidence to individuals. Yes, so both medications, talking therapies, and also physical therapies, which I don't think the audience may appreciate too much because they're very medical. But they're there, and we treat them. And it's best to go to hospital for their management.
Nebitatugaza tugenda tulabe okukerewa tukimanyi tukikola era twenyumiriza so nno we tutamanya biseera byegulumye we tutamanya